Thank you, Patty. My name is Rustin Morse,
And I'm Leanne Wallace.
and we are here to talk to you about the Quality and Patient Safety Strategic Plan. And we have a guest here today. This is Jody. You'll see Jody moving while we present. We are in the Simulation Center, down in the storeroom, and Jody wanted to join us. Our strategic plan really has three core elements. One is a new framework, the second is reimagining Zero Hero, and the third is the establishment of the Center for Clinical Excellence. I'm going to talk to you about the framework. So our framework is really redesigning what we focus on, reprioritizing what we focus on from a quality and patient safety perspective. We brought a group together, we started thinking about what was most important, and we came up with a few key elements: safety, clinical outcomes, population health, equity, and experience. Conveniently, this spells scope. This will be our framework going forward. It will be the way we evaluate, conceptualize, consider, and measure quality and patient safety for at least the next 5 years.
For over 10 years, Zero Hero has been the foundation of our patient safety program, and we've made significant progress in our journey to zero harm. Now we're going to take a moment to reimagine what safety actually could look like, and we're going to do it in a couple of ways. First, we're going to strengthen our Zero Hero tools and our training. We're also going to widen the lens of safety to not just include patient safety, but also include employee safety, as well as to challenge ourselves to look at attempts to reduce harm that we previously maybe thought we could not prevent. We're also going to leverage the abundant data we have to try and develop predictive analytics so we can better understand our patients' risk for harm. We're also going to use smart dummies like Jody to help our clinical teams do simulation to reduce harm. We're also going to think about looking forward versus looking back at what didn't go right, but looking forward to what did go right and try and more consistently and reliably have those things go right. The other thing we're going to do is develop initiatives to support our one-team culture, to enhance our patient and family experiences through provider to provider and provider to patient communication.
That's terrific. Zero Hero is getting reimagined and re-energized. I couldn't think of anything more important as part of our quality strategic plan. The next aspect is the establishment of the Center for Clinical Excellence. This is an outgrowth of the work that we've already been doing with guidelines and pathways. We're going to take that work, leverage it, and grow that work so that we have an abundant framework of care processes or guidelines or pathways that make it easier to do the right thing. They will articulate what is most important in care delivery, embed it into the medical record through clinical decision support, and make it easier for clinicians and providers to provide the best care possible aligned with evidence-based outcomes. We will also develop a complementary set of measurement frameworks that will allow us to measure performance around best practice quality indicators and the impact of outcomes. And this will link to our scope framework, as we will have measures in each of these domains as we build this portfolio forward.
So how are we going to achieve these amazing results? Well, first, each of our service lines will develop a scorecard based on those scope metrics, and they will report and measure all of those outcomes. As was outlined in our Center for Clinical Excellence, we will have care pathways. Over 80 of them will be developed and implemented, and then we will measure their impact. Additionally, we will have top quartile performance in our Pascal Culture of Safety survey. So what do you think about that, Jody? All good
great.
for the kids and the babies we take care of. And with that, we'll turn it over to Rick.